Hello, this is Dr. Lewerenz at Longevity Health Institute. Good afternoon on this late April, early evening, beautiful day, actually sunny in the 70s. I think we're blessed post-Easter here, right? So I want to share with you a case, but I want to talk to you about two hormones, and you know me in our functional personalized medical system that we always look at root causes. And one of the main foundational systems that you always have to focus on is hormones and hormonal balance. Can't ignore any of them. They all are very important. They're all very strong. Whether we're talking about a sex hormone or a neuroendocrine hormone or an anti-inflammatory hormone, hormones mean everything in as far as prevention and wellness. You can't ignore those. You should not live in fear of those. So there's two hormones that I want to speak of today. You've heard me speak of one before called progesterone, and I'm going to talk about that, and another one called pregnenolone. Pregnenolone, I don't know if you've heard me speak of, or even if you're my patient, heard me mention much about, because truthfully it is a fairly weak hormone, and that is pregnenolone. But what I mean by weak is it's way upstream in the stereogenic cycle of hormones, okay, where it's made from. And so it's not as profound at the receptor often. And to be honest, it's a very maybe 50-50, 60-40% of people will notice a objective difference in how they feel, or that would be subjective actually, but in how they feel, okay? But what my point is that it would be something that is noticeable or significantly noticeable, not just benefiting it from a well standpoint. So what is pregnenolone? Pregnenolone is kind of, if you will, the grandmother of all hormones. I actually have even here a little chart, little pathway of the stereogenic hormone pathway and the enzymes that influence these hormones. And as you can see up here at the top, and we won't go through all of this, but actually all your hormones that are right come from cholesterol. Actually, even today I saw a young gentleman with very low cholesterol, total cholesterol of 120, and actually he had very low cortisol. And as you can see, excuse me, I'll bring this up again, cortisol makes pregnenolone, makes hydroxypregnenolone, makes hydrocortisone and cortisol and progesterone, and you can see this cascade of how all hormones are made. The thing is, though, is in the stereogenic pathway of these hormones, is that it's not as easy to just say, oh, well, take in more cholesterol or take in more hormone upstream and they'll all trickle down. It'd be nice if that worked that way, but it doesn't. The body is very intricate, and there's many enzymes that work and back and forth and actually can even get burnt out and then don't do conversions. So it's not that easy, okay? But what it does tell us in somebody that's young, like that young gentleman, if you got low cholesterol, you do have to be concerned about other stereogenic hormones that you might be underproducing those. And so we're looking to those for him because he has major fatigue, he has some OCD and some chronic fatigue issues, if you will. And so these are things that actually can really affect him at a functional level, and really impact his whole entire life as far as school and his early career. He was 23. Again, a low cholesterol affecting other hormones downstream. So back to pregnenolone. Pregnenolone, the grandmother of all hormones. You can see downstream pregnenolone goes to hydroxy progesterone and pregnenolone, and it goes to progesterone. It also converts over to hydrocortisone and then cortisol. So what is pregnenolone? Pregnenolone helps, it's really a neuroendocrine hormone. It's really a neuro anti-inflammatory hormone. And what does that mean is it really supports mood and brain health, especially brain inflammation. It can really enhance memory when it works. It can really enhance often vision, brightness, hues, your cones and rods of your eyes, things get sharp, things like this when they are needed. And it has some other downstream beneficial effects. But where do we see it really impress somebody? So when you have high stress demands, often you'll get a pregnenolone, they call it steal, and your pregnenolone will go down as well as your cortisol, obviously, because it's even further downstream. So pregnenolone you do have to consider in a patient that has a lot of stress going on, a lot of memory or mood issues going on, particularly depression or anxiety related with stress, maybe OCD, potentially bipolar. There's actually even some studies on bipolar and schizophrenia with pregnenolone. Often I find it benefits people with some mild cognitive impairment in stress-related memory, brain fog issues, okay? What's interesting about it is this: if you had any cognitive risk, and today I saw somebody that actually was 61 years old, very healthy, and had a stroke, and was coming in for my input from a neuroendocrine and even inflammatory and cardiovascular standpoint after she saw her cardiologist and neurologist, etc. But I put her immediately on that because pregnenolone is very brain protective and very anti-inflammatory. And post-stroke, vascular damage to the brain is going to have some inflammation for 4 to 6 months. So this should actually help her out a lot. And she was experiencing some memory and brain fog and some mild cognitive decline. But I love pregnenolone when it works. In fact, a lot of people will even say that their vision becomes improved, and some of the hazy, foggy vision that they have at times can be taken away. So it's worth trying. Personalized approaches are always best, meaning typically not high doses, usually 20, 30, 40 milligrams, or at most. You want to get a sustained release, a controlled release pregnenolone. Should be a professional medical grade. Of course, that's what we carry here in our office and on our warehouse, on our website. But you want quality pregnenolone. It's not expensive. Just get the good stuff, okay? And give it a try. There's no harm to it. It has a lot of benefits. And actually, there's even a study done in 1997, I believe, but it was on the improvements of ovarian cancer. It was very anti-proliferative to ovarian cancer. So if anything, it looks beneficial. Now, to progesterone. Now, yes, it is, like I was shown on you here, it is downstream progesterone from pregnenolone. The thing that happens though with progesterone, this is why I want to share this with you, is that what is progesterone? Well, progesterone is a sex hormone. It does go down in early perimenopause or early menopause. We'll see it often now drop now in somebody's mid-30s and that because of stress. The ovary will make less progesterone when somebody has adrenal stress or has any stress, whether that's pituitary stress, emotional, mental, psychological stress, a post-traumatic stress disorder, or just psychological, life burden. And their progesterone will drop even more, even earlier than perimenopause or menopause. The thing though is that what's beautiful about progesterone is this: we call it the feel-good hormone. People will sleep better. They'll have a better wellness feeling. They'll have less anxiety. It is breast cancer protective. I can't state that enough. Natural bioidentical progesterone has studies that show it's breast cancer protective. It's anti-proliferative to breast tumors and cells and inflammation. So it can help even fibrocystic breast disease and such, okay? This is why you never want to be, and you've heard me say this, you never want to be estrogen dominant, okay? Never. So natural progesterone is a complete opposite of synthetic progestin or pharmaceutical grade chemical derived synthetic progesterone. We don't advocate that. And studies are also negative on that for arterial damage and blood clotting, etc. Okay, so natural progesterone is the way to be. Another personalized approach. See a doctor that's capable, got hormone experience, does personalized functional medicine, and has some endocrine knowledge, because then it'll be done right. Today I had a lady on follow-up after 1 month, okay, and she's perimenopause, going into menopause, not sleeping good, a lot of stress, weight gain, okay, a lot of emotional kind of stuff going on. Had the last couple of years were pretty tough on her, okay. We use both pregnenolone and bioidentical natural progesterone in a very personalized way, conservative way, but looked at her levels. Today we're retesting her levels. But in 1 month, she said that she already felt amazing, felt great, sleeping better, felt mentally right, cognitively right, got some drastic improvements. Now, she's not fixed. We're going to work on her weight. We're still working on her diet, gut and diet. You hear me say this all the time, or everything, almost everything. But we'll get her hormones right. And I think she'll do lovely, and her weight will come off just because she's functioning and feeling better and more metabolically sound. But I just want you to hear about and remember the benefits and the importance of a personalized, balanced approach with your hormones, particularly in this kind of case, progesterone and pregnenolone. The other thing I do want to state related to pregnenolone and post-traumatic stress disorder. You can have post-traumatic stress when you don't have necessarily a major, if you will, military trauma. It could be emotional trauma. It could be a divorce. It could be an illness. It could be a loss of a loved one. It could be anything that is causing post-recall, and it's a traumatic wound experience that brings you an emotional, core, gut kind of emotional experience, whether that's affecting you from an anxiety, a depressive, apathy standpoint, or remediating over things in your mind over and over, interrupting sleep over and over. But my point being is that these are all forms on the spectrum of post-traumatic stress. Post-traumatic stress is very real. There are studies, and there are huge benefits on pregnenolone in those cases. And the reason is, even if it's just for 3 to 6 months, is again, pregnenolone acts as a neuro anti-inflammatory hormone. So you're actually healing the pituitary, you're healing the brain. And obviously, if somebody takes in then some cognitive behavioral therapy or psychology approaches, counseling and psychological approaches, meditation, yoga, such things that actually bring the mind-body together with pregnenolone, there can be wonderful benefits related to post-traumatic stress. So hopefully this is enlightening, educates you, share with others. You hear about all these post-traumatic stress incidents because our world is so crazy and it's so upside down and not funny or tongue-in-cheek. A lot of things that we can never imagine happening in our world, stressors and things that are every day happening every week, tragedies and traumas in our country and others are every day happening. And PTSD is very real and needs real treatment and real approaches, and is not necessarily an external wound. It's actually an internal wound, so it has to be investigated very seriously and very carefully. So I hope this educates you. I hope you found this enlightening. Longevity Health Institute here in Michigan. This is Dr. Lewerenz. I hope you're well. Continue to live well, and do what's right in the wellness protocol that suits you, but always find and look for a personalized, functional medical specialist. This is Dr. Lewerenz. Be well.